Liver disease is claiming 4% of the 2 million lives lost each year. It stands as 11th leading cause of the death globally.
Dr. Deepika Krishna, a renowned health coach and premier health strategist, is going to reveal the truth about fatty liver.
Liver disease is claiming 4% of the 2 million lives lost each year. It stands as 11th leading cause of the death globally, highlighting the critical health crisis that demands an urgent need. Ever wonder why your doctor keeps on telling you to get your liver test done, check your liver enzymes, or that beer belly which is just saying so many things loud which hearing? Today we are going to peel the layers of this silent killer, which is the fatty liver disease. Hi, I'm Dr. Deepika Krishna, and we are going to discuss the difference between alcoholic fatty liver and the non-alcoholic fatty liver. Picture this, your liver, the powerhouse organ that detoxifies your blood, produces bile, and regulates your metabolism, slowly suffocating under the blanket of fat. Sounds dramatic? Well, it's happening to near about 25% of the people worldwide, and most of have no clue about it. Well, you might be thinking, well, doctor, I don't drink too much. So here's the cake. Alcohol is not only the culprit. Non-alcoholic fatty liver diseases are skyrocketing. And it has got nothing to do with your Friday night cocktails. Now, non-alcoholic fatty liver disease, we have to understand that what happens in this. In this situation, the triglycerides in our body are not able to metabolize. As we know that liver is an organ which metabolizes the fats. Triglycerides are one kind of fats. So when the triglycerides are starting to accumulate inside the liver cells get inflamed. When the liver cells start collecting the triglycerides inside them, the condition is called hepatocytes. Now, what happens in this condition? The liver cells, let's assume that this is a liver cell, the triglycerides which are not able to metabolize, they are getting inside the cell, and that's not the condition what we want. That can lead to inflammation, and eventually that can lead to scar formation and fibrosis. Now, let me break down this situation giving you an example. Imagine a parking lot which can be, let's take a parking lot as a liver, and the cars which are parked inside the parking lot are a triglyceride. So in a usual scenario, there are parking lots allotted for each car. When the car comes, they park themselves in the particular parking lot and they move out. That is the healthy situation. The car comes, it parks, and after a certain time, it moves out. But at an unhealthy state, lot of cars start coming inside the liver and they park anywhere and everywhere, making it a complete mess. Now, a lot of car, meaning a lot of triglycerides, are coming inside the liver, making it completely a mess, damaging the floor, making scars everywhere. In the same way, where the car are damaging the parking lot, the triglycerides are damaging the cells. That situation is called the inflammation of the liver. Now, what does in a normal scenario in a car parking, what would they do? They would repair those scars, the damaged areas on the road. They would add some more cement and try to repair it. When this situation happens in the liver, the inflammation which has developed the scar, which has left the scar on the liver, when it is repaired by scar tissues, because we have lost the healthy cells at that particular area. Hence, the situation of fibrosis comes up. Now, how do we understand if we are having a fatty liver or not? Number one rule method is that without getting any test, first case scenario, if you're standing and if your belly is protruding out and you're not able to, when you look down, you're not able to see your thumbs, that is the first indication that you might be having a fatty liver, and it is an alarm that you should go and get further test, the liver fatty acid enzymes check done. Now, the symptoms which can happen is a heavy sensation towards the right side, the upper abdomen of the right side, a little uneasiness you can feel, that can be a reason because of the hepatomegaly, which is an enlargement of the liver. You might have a little bit of pale skin, nails, which is a situation called jaundice. It can happen other than jaundice as well, where your biles are not produced properly. Your food cannot be digested easily. Either you're having constipation or you're having loose motions. That is also an indication that you can have a situation called fatty liver. And other than that, when you feel extreme lethargy, you feel pukish, you don't know the reason, you have uneasiness sensation, the heaviness towards the right side, you feel it more when you lie down. So these are some conditions by which you can understand that you can be having a fatty liver. A lot of time people get confused with non-alcoholic fatty liver and fatty liver. In fact, I know people who come to me and they will say, I might be having, I don't drink alcohol, I don't drink anything, but still I have this fatty liver. So that situation, like I mentioned guys, that is a situation of non-alcoholic fatty liver. Now, alcoholic fatty liver is kind of a little bit different scenario where the alcohol, when it metabolizes, the ethyl alcohol, when the metabolism happens, it damages the liver by releasing the fatty acids, which damages the liver. Condition like liver cirrhosis and a pain in the liver, you can have again a lot of bile, which is shown by the yellowness of your skin, and these conditions are also the symptoms that you can have alcoholic fatty liver. So now you have to watch out that what kind of fatty liver you have. If your belly is protruding out, definitely you should go and get the liver enzymes test done. Now, other than that, of course, the doctor would palpate the right side of your abdomen, finding out that the reason to do that the doctor wants to know if you have any kind of hepatomegaly situation or if you have any kind of pain on touching at that particular area. And in liver enzymes, the test will entirely speak about the situation of the liver. You can always reach out to your doctor and start working on it. The good news here is that the liver is reversible organ as well. That means that you can always make your liver healthy if you start early. But if a situation has reached to cirrhosis or fibrosis, reversing the liver situation gets difficult. So just start early. A regular detoxification is absolutely must. Few things which you can include to take care of your liver on a regular basis is number one is milk thistle. Milk thistle is a brilliant antioxidant and meant for liver. It is called a liver supplement all itself. So include some milk thistle on a regular basis. Adding some apple cider vinegar to your meal regularly would take care of the blood sugar levels, and hence that will decrease the fat collection in your body because it will help you metabolize the fats, which of course we want to get rid of. The third which you can do is include green vegetables, green fibers like broccoli, like raw banana, raw papaya, Brussels sprouts. These things are again a beautiful fruits and vegetables which you can include. It takes care of the liver, it takes care of the liver cells. A regular detox drink, if I can suggest, would be that can be something with adding a hint of spirulina. You can add some blueberries, you can add some coconut water to that, coconut milk or water depending on your taste. Add some dates, throw in some kale or arugula or any green leaves like spinach and all. Churn it out, and then you can have this is also a good heavy metal detox which shows wonderful. Liver also faces a lot of heavy metal organs, because understand guys, like liver is something which is continuously detoxing your body. So heavy metals which your body is absorbing all the time via food, via the cream, lotions, through the air, we need to clear it out, and liver is the only organ which is doing it. So to support liver, adding smoothies like this is a great idea. And last but not the least, fasting is a great idea if you don't want to do any of the above stuff and just want to do a simple thing. So yeah, fasting, and when you open your fast, start gradually. Include first a very healthy fat. It can be avocado or some cashews. Then have your fibers in the form of vegetables. Include a lean meat, a tiny portion, because you have been fasting the whole day, and complex carb to give you energy the whole day. Just remember that liver is a beautiful organ. Absolutely need our liver. That is one organ which is detoxifying your body, which is responsible for your weight gain, weight loss. That means it takes care of the metabolism, and it is also very important for the absorption of all the right kind of nutrition. So take care of your liver and take care of yourself. Bye.